Hello, I'm Dr. Haig Satrakian, bringing you a little POCUS review just in time for your next pediatric patient. Today, we'll be talking about how to set up your ultrasound machine for use in ultrasound-guided venous access. If your patient has no contraindications, you can move on to selecting the right tools for the job. Your own practice setting is likely to have one of two broad categories of ultrasound machines, with examples shown here. On the left is a machine that is designed for vascular access. On the right is a general purpose machine that can be used for many ultrasound applications, including vascular access. The reason for using ultrasound guidance is to better visualize the veins that we're looking to cannulate. For this reason, we should take the time to learn how to adjust our machines to provide the best possible images. In this example, you can barely make out a vein in the middle of the screen. What can we do to ensure we get better images than this? First of all, we have to choose the right probe. In general, we'll reach for a high-frequency linear probe like the one shown here. In general, this type of probe is best for viewing superficial structures with high resolution. We will also want to be familiar with a few of the controllers on the ultrasound machine. Color flow can be used to demonstrate movement, like the flow of blood within veins. The transducer button will allow you to select the linear transducer. The gain knob will generally increase or decrease the brightness of your images. Some machines have a one-push optimizer button, which can in many cases clarify the structures in the center of your screen. The depth knob can be adjusted to ensure that the anatomy of interest is in the center of the screen, where it will be seen most clearly. Your machine should also allow you to measure structures visible on the screen. Color Doppler can help you distinguish between arterial and venous waveforms. Analogous functions are present on more compact machines as well. Here we can see an example of how gain is adjusted to better visualize a vein. To the left, the image is overall too dark and can be referred to as undergained. To the right, the image is too bright and can be described as overgained. In the center, one can clearly distinguish between the hypoechoic or dark vein and the relatively brighter tissue surrounding it. Here we see how reducing the depth brings the object of interest into better view. Incidentally, you can see a row of blue dots here, which are seen when the machine's biopsy function is active. Some practitioners find this helpful in lining up their needle's trajectory with the target vein. Now that you can adjust your machine to show you a better image, you can move on to searching for veins. At a basic level, you'll want to distinguish blood vessels from other structures such as nerves. You'll then want to distinguish veins from arteries. Here we see the use of compression as a technique for distinguishing blood vessels from other structures. In general, blood vessels should collapse with compression, and veins should collapse with less pressure than arteries. With light pressure, one can see how the veins in this location collapse, while the artery remains patent. Nerves must also be identified and distinguished from blood vessels. They are often found in association with blood vessels and have a characteristic honeycomb appearance. They should not collapse with compression. This view of the nervous and vascular structures seen at the level of the mid-humerus demonstrates the basilic and brachial veins highlighted in blue, the brachial artery highlighted in red, and the median, radial, and ulnar nerves highlighted in yellow. In this clip, we can see how the color flow function highlights the basilic vein, which flashes blue when we squeeze the forearm, a technique called distal augmentation. In this case, spectral Doppler is used to illustrate a venous waveform on the left and an arterial waveform on the right. This function can be used when compression and knowledge of local anatomy do not suffice to distinguish between veins and arteries. Now that you know how to set up your ultrasound machine to guide vascular access, You may wish to review our next video on selecting an appropriate access site and catheter. If you wish to read more into this topic, a list of references is provided here.